This is a technique video for repairing complex meniscal tears with the Meniscus cup implant. A cadaver knee is positioned at 90 degrees of flexion. Medial and lateral parapatellar portals are established. The surgeon performs an initial diagnostic arthroscopy, identifying and assessing the meniscal tear. While the tear is being examined, an assistant prepares the Meniscus cup implant. The implant is cut to appropriate size and placed in open jaws of a surgical clamp. The surgical clamp containing the implant is then inserted through the enlarged medial portal. Once inside the joint, the jaws of the clamp are opened, positioning the implant over the body of the meniscus, covering both the femoral and tibial sides at the site of the tear. The clamp is then removed once the meniscus cup is appropriately placed. The first suture anchor is placed using a curved delivery needle. The needle is directed into the posterior third of the meniscus cup, with the inner curve aimed at the tibial surface of the posterior horn of the meniscus. The needle is advanced until it penetrates the entire thickness of both the meniscus cups and the meniscus, with the anchor deployed at the rim of the meniscus. The second anchor is then placed in a similar fashion from the femoral side. Once both anchors are deployed, the suture is tightened with a sliding knot, and a knot pusher is used to advance and secure the knot. The suture is cut, leaving a 2 to 3 mm tail. A second suture is placed at the anterior border of the meniscus cup using a vertical technique. Finally, an outside-in suture is placed at the anterior edge of the meniscus cup and the anterior portion of the meniscus. This series of sutures ensures that the meniscus cup is securely wrapped around the meniscus, stabilizing the tear. The surgeon may use any combination of sutures of their liking. An arthroscopic probe is used to confirm that the meniscus is securely stabilized and that the implant is properly positioned. The meniscus cup restores the shape of the damaged meniscus and maintains adequate tension, preventing extrusion. Once the meniscus is secured, bone marrow is harvested and prepared. The knee is then dried using a shaver. The aspirated bone marrow is injected with a long needle between the meniscus cup implant and the meniscal tissue using direct arthroscopic visualization and the dry arthroscopy technique. Thank you for your time.